Have you ever had a cough that just won't go away? Maybe you're dealing with it for weeks or even months, and no matter what you do, it just lingers. Chronic cough is more than just an annoyance. It can affect your daily life, your sleep, and even your relationships. But what causes a cough to last so long, and what can be done about it? In today's video, we're going to explore the causes of chronic cough, how doctors diagnose it, and the best ways to manage and treat it. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Coughing is a normal reflex that helps clear the airways of mucus, irritants, and foreign particles. We all experience occasional coughing due to colds, allergies, or environmental triggers. However, when a cough lasts for more than 8 weeks in adults or 4 weeks in children, it's considered chronic. Unlike an active cough that comes and goes with an infection, chronic cough can persist without an obvious cause, making it frustrating to deal with and challenging to treat. A chronic cough can be dry or productive, meaning it may or may not bring up mucus. Some people experience coughing fits that disrupt sleep, while others have a mild but persistent tickle in the throat. It can be triggered by talking, laughing, cold air, or specific odors. Some people may also experience other symptoms alongside their cough, such as sore throat, hoarseness, shortness of breath, or even chest discomfort. Now, let's take a closer look at what might be causing your chronic cough. There are several possible causes of chronic cough, and sometimes more than one factor is involved. The most common causes include postnasal drip, asthma, gastroesophageal reflux disease, chronic bronchitis, and the lingering effects of a respiratory infection. Postnasal drip, also known as upper airway cough syndrome, occurs when excess mucus from the sinuses drips down the back of the throat, triggering the cough reflex. This often happens with allergies, sinus infections, or even irritants like smoke or pollution. People with postnasal drip may feel this constant need to clear their throat or notice their cough worsening at night. Asthma is another frequent cause of chronic cough, especially in people who also experience wheezing, shortness of breath, or chest tightness. In some cases, a condition called cough variant asthma occurs, where the main symptom is a chronic dry cough without typical asthma symptoms. This cough can be triggered by cold air, exercise, or allergens. Gastroesophageal reflux disease, or GERD, is another major culprit. In GERD, stomach acid flows back up into the esophagus, irritating the throat and airways. This can cause a chronic cough, often worse after eating, lying down, or at night. Some people with GERD-related cough don't experience classic symptoms like heartburn, making it harder to identify. Chronic bronchitis, a form of chronic obstructive pulmonary disease, or COPD, is a long-term inflammation of the airways, often seen in smokers or people exposed to air pollution. This condition leads to a persistent productive cough that lasts for months and can worsen over time. In some cases, a chronic cough is a lingering effect of a past infection. Post-viral cough syndrome occurs when the airways remain inflamed for weeks or months after a respiratory infection, such as the flu or COVID-19. The cough tends to be dry and triggered by talking, exercise, or exposure to cold air. Less commonly, chronic cough can be caused by more serious conditions, such as lung infections like tuberculosis, lung cancer, or interstitial lung diseases. Certain blood pressure medications, especially ACE inhibitors, can also cause a persistent dry cough in some people. Given the wide range of possible causes, how do doctors determine the reason behind a chronic cough? Diagnosing chronic cough involves a detailed medical history, a physical exam, and sometimes specialized tests. Your doctor will ask about the duration of your cough, its characteristics, and any associated symptoms. They'll also want to know about your medical history, smoking status, exposure to environmental irritants, and any medications you take. A physical exam may provide clues, such as nasal congestion indicating postnasal drip, or wheezing suggesting asthma. If the cause isn't immediately clear, further tests may be needed. A chest x-ray is often performed to rule out lung infections, cancer, or other serious conditions. If asthma is suspected, lung function tests such as spirometry may be done to assess airway obstruction. For GERD-related cough, a trial of acid-suppressing medication can also confirm the diagnosis. In some cases, doctors may recommend a CT scan of the sinuses or lungs, bronchoscopy to examine the airways, or allergy testing to identify potential triggers. A methacholine challenge test can help diagnose cough variant asthma by assessing airway sensitivity. Once the underlying cause is identified, treatment can be tailored to address this specific issue. Managing chronic cough involves treating the underlying cause while also relieving symptoms. If postnasal drip is the culprit, treatment may include nasal saline rinses, antihistamines, or nasal steroid sprays to reduce inflammation. Identifying and avoiding triggers like allergens, smoke, or strong odors can also help. For asthma-related cough, inhalers such as bronchodilators or corticosteroids are often prescribed to control airway inflammation. Patients may also need to manage triggers such as cold air or exercise by using preventative medications. GERD-related cough typically improves with lifestyle changes and medications. Avoiding large meals before bed, elevating the head while sleeping, and reducing acidic or spicy foods can help. Proton pump inhibitors, or PPIs, or H2 blockers may be prescribed to reduce stomach acid production. For chronic bronchitis, quitting smoking is crucial, as continued exposure to tobacco smoke worsens airway inflammation. Inhaled bronchodilators and pulmonary rehabilitation can help improve lung function. Reducing exposure to air pollution and other irritants is also important. If post-viral cough is the cause, patience is often key, as it can take weeks or months to resolve. Drinking warm fluids, using cough drops, and avoiding irritants like cold air can provide symptom relief. In some cases, doctors may prescribe inhaled corticosteroids or a short course of cough-suppressing medication. For medication-induced cough, such as from ACE inhibitors, switching to an alternative medication can resolve the issue. While most cases of chronic cough have a treatable cause, some cases remain unexplained, a condition known as chronic refractory cough. In these cases, doctors may use neuromodulators such as gabapentin or amitriptyline to reduce nerve sensitivity in the throat. Behavioral therapy, such as speech therapy, may also help retrain the cough reflex. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, if you've had a cough lasting more than 8 weeks, it's a good idea to see a doctor for evaluation. However, there are certain red flags that require urgent medical attention. These include coughing up blood, significant weight loss, difficulty breathing, chest pain, or a history of smoking with worsening symptoms. These could indicate a more serious underlying condition that needs immediate investigation. Chronic cough can be frustrating and disruptive, but in most cases it has an identifiable and treatable cause. Whether it's postnasal drip, asthma, GERD, or another condition, finding the right treatment can bring relief. If someone you know has been struggling with a persistent cough, don't ignore it. Talk to a doctor to get to the root of the problem. Thank you for watching. As always, take care of yourself and make the most of your day.